Hi, I'm Tara Cook, owner of TLC Dyslexia Services and Master's Level Certified Barton Tutor. I'm very lucky today. I have a colleague of mine, Dr. Kelsey Lisle. She is a neuropsychologist, and we're here to talk about evaluations. My last video, I kind of left you guys on a cliffhanger that my children were waiting on a evaluation. And the thing that I was so lucky with mine is back then I had Dr. Flora Howie, who was a developmental pediatrician, and she was very comfortable navigating the waters of dyslexia. But a lot of evaluators aren't. And this is why I recommend her so often. Could you tell us a little bit about this evaluation process and why it looks so different? And why the evaluations can come out so different?
Oh, it's a good question. I feel like, for one, everyone's trained differently. I, being dyslexic myself, have a special interest in dyslexia.
Yes.
So I feel like that's really helpful in...
Your reports are very well written.
Oh, thank you.
They're gorgeous.
I really do a deep dive into reading, and any good neuropsych should be able to give you a clear understanding of the reading process from phonological processing through decoding, sight word reading, fluency, and comprehension. And the goal is, along that process, you're trying to figure out where the disruption is. And for kids with dyslexia, it tends to be in the phonological processing and the decoding skills, which then impact the fluency, and then you get poor comprehension.
Yes.
So the idea of a neuropsych evaluation in particular is that you're not just looking at reading. You're looking at reading, writing, math, cognitive ability, attention and executive functioning, and social and emotional functioning. And you're looking at, is there anything else going on in the reading process that is getting in the way, whether it be low cognitive skills, poor processing, a language impairment, an attention deficit, that is contributing and is a better reason for the disruption in reading. And the only way to know all of those things is to do a neuropsych evaluation because it looks at everything all together, as opposed to, I think a lot of people try to go down the educational psychoeducational route, or a speech evaluation, or...
Well, like a school psychologist ones are often the most confusing to me of all.
So school psychologists are in a unique position, and part of my degree is that I have a certification in school psychology, as that was a way to get to my doctorate. By trade, I'm a school clinical child psychologist.
Right.
So I have the unique, I'm in a unique position where I worked in the schools as a school psychologist for a couple of years. I didn't know that. And when you're in the school district, you're not really allowed to diagnose an attention issue.
That's kind of where I'm going.
Or autism. And you'll see it sometimes a little bit they'll kind of refer out, or they'll say like, oh, maybe you should see a psychiatrist, or they'll point you kind of in the right direction, but they can't really commit to it. Those evaluations are really only allowed to look at academic skills and cognitive ability.
Okay.
They're not really you're not going to get more depth than that.
Into the why of the matter.
They're only looking at, does this individual fit the 13 classifications of getting an IEP or a 504 plan, right?
Yes.
So one of the classifications is a specific learning disorder. A specific learning disorder is a broad term.
Which is SLD.
SLD.
Right.
It's a broad term that encompasses many different types of learning challenges. It's not just dyslexia. So it's kind of an umbrella term. And underneath of that is the diagnosis of dyslexia. But because they can't treat dyslexia really in the school system, they're not equipped to do so. They're not going to diagnose it, because then that would mean that they would need to address it with evidence-based practice, which would
Gillingham
be Gillingham, Barton, any sort of structured phonics-based reading intervention program. So instead, they'll say it's a specific learning disorder. So that really is the school psychologist route.
Because the why does matter.
It does, especially if you want to treat the dyslexia. It really requires that intervention, and you can't get it within the school system. But they can't tell you really this is what you need, because then they would have to provide it. So it leaves this, for parents who don't know, it leaves this blank.
Yes.
And then it stops the kids from getting more support, or it delays them. Because typically what happens, our parents are like, the public school's not really doing what they need to be doing, or we're not making progress, we're still in this position. And then unfortunately the kids waited 2 years, right? They're doing
At least.
response to intervention, RTI,
Right.
and nothing's really making big progress. And then their self-esteem declines more and more and more. So they end up getting an outside evaluation.
Well, and they think that they're getting evaluated too. So there's this kind of
As they should,
misperception
right? Parents
that the
should
parent
trust the
has
school system in that.
But they can't really do what you're able to do now.
Right.
So
Right.
then the second part is, what a good evaluation, such as what you do, they pretty much have to have an IQ test, don't they?
They have to have an IQ test.
What else
in my
do they
opinion,
have to
right?
have?
Because you're going to find people that can they'll sell you anything, right? Like that's just the world that we live in. In my opinion, in order to have a good evaluation, you have to look at IQ, because one of the criteria for having dyslexia is that it's not better explained by
Right.
some sort of cognitive disorder.
Absolutely.
You have to look at speech. You have to look at processing speed, working memory. You want to look at attention and executive functioning, and then social and emotional skills. One of the big parts, it's not just to rule out another issue. That is one part. But it's also to understand, when we provide the dyslexia intervention, how does it need to be provided? Do we need to get speech first and then the
Often,
dyslexia?
yes, of course.
Do we need to do it during the school day because they have an attention problem?
Gosh, yes.
Because think about it, the kid goes to school all day, and then after school, on top of all of that, then they have to get the tutoring.
They're exhausted.
Not every kid has the attentional bandwidth to do that.
No.
So you might be, as a parent, spending tons and tons of money on this really high quality intervention, but they're not getting enough out of it.
Right.
Because they're already exhausted,
Yep.
or their processing speed can't keep up, or their attention's not there. So in those situations, a good neuropsych evaluator will be able to tell you, listen, based on this kid's profile, this particular child needs to be provided the intervention during the school day.
I agree with
And
that.
here are some options in terms of schools that can provide that in the area. They need to know the schools, they
Right
need to
now,
know the
Holy
area.
Family is allowing our tutors to go.
LCC,
Yes.
I would say Shorecrest has their own learning
Right.
support program. Like, there are definitely
A handful.
schools. DePaul is a great example that they're a school specifically for dyslexic kids. Like, that's a great place if you have maybe like a little bit lower self-esteem and you need to make significant progress. Tampa Day School, like there are a myriad of options available to you, but it really depends on the kid what is going to fit best for them.
Yeah.
It's not a cookie cutter situation.
Well, and you're comfortable making that kind of a determination.
I'm comfortable being very direct in
Yeah,
making that, because
I am
I don't
too.
want the parents leaving my office and being like, oh, I don't know, there's all these options, what should I do? I will tell you in rank order exactly what I think would be best.
I'm the same way too. I just feel that people need guidance on the reality of this
Right.
process. And it is a big one.
Just like when I have a kid who comes in who is lower functioning cognitively, I say, here's what we need to be looking like in terms of long-term future. We need to be talking about life skills. We need to be talking
Absolutely.
about setting expectations for like what happens after high school, right? It doesn't do anyone any good not to look at the whole picture and to lay out a
I
plan
think
for
most
them.
of the severe dyslexics need that early on. It's
Yeah.
hard to say, but it's just, especially if they've got ADHD, executive function,
It is a rarity for me that I get a kid with just one thing going on. It is the exception
Me too.
that I have a kid with just a really smart dyslexic kid. There's usually something else going on. Whether it's diagnosable or not doesn't really matter. It's a piece of the puzzle, and if we don't understand that piece of the puzzle, then we can't give them the best intervention possible. And think about it, like, I get that it's expensive. I understand that it's an investment, but you're investing up front so that you're not wasting time, money, and ultimately the kid's self-esteem later on.
Absolutely.
Because you're going to be paying for interventions and it might not be the right one. And then where did we leave the kid?
It's hard. And
I
that's
think
why the
too-
evaluations matter so much. I feel they get confused right off the bat.
I see that a speech language pathologist, the speech language pathologists that do the evaluations and say that there's dyslexia, they often miss other things going on.
Absolutely, and
then
they come to bear.
You saved money doing a speech language evaluation because it's probably a fraction of the cost, but what did you do? You're spending more money in the long run because you didn't look at the whole picture. Screeners are not an appropriate evaluation for dyslexia. You don't do a screener and then decide it's dyslexia. I would be very cautious of that. If you're doing the evaluation and you're sitting with the neuropsych evaluator, which should be a psychologist, they should be able to tell you exactly where the disruption in reading is. And then you can ask as a parent, is this dyslexia? If they say no, say, why not? Explain to me why not.
Right.
That's a helpful way to go about the feedback process.
Yeah, well, these are big issues for families, and I think that the evaluation part, right, it's front-loaded for the families right from the beginning.
It's better to get a roadmap before you start taking the journey.
I agree. Well, I'm so appreciative that you were willing to come and talk with us and help our community here. It's a big journey, and I think it's hard right in the beginning to get the right information.
And I think reaching out to resources in the community and other parents who have kids with dyslexia or schools in the area that support kids with dyslexia to get your questions answered before you take the next step. Do the research, AI is there for us now, right? Like ask the questions
I've named
that you
mine
have.
Spark.
Yeah. Ask the questions so that you know
yes.
how to do it, because like I always say, no one gives you a manual when you're leaving the hospital with your baby, right? You don't know what you're doing, and it's okay to not know and ask questions and learn about it.
And we learn more as we go along.
Mm-hmm. Yeah.
Well, I'm just so grateful that you're willing to talk with us today. If you guys have any questions, you can certainly leave a comment or, certainly call, Dr. Lisle is excellent. It's Bay Kids, correct?
Bay Kids FL. Yeah, I'm always happy to answer questions.
Yes, and I am as well. So we will see you guys next time.